Hi, Kevin Sartin with Knob Noster Physical Therapy, here with an educational video on hip osteoarthritis. Buckle in, this is going to be very, very exciting. So just want to tell you a little bit about hip osteoarthritis. Maybe if you know someone that is dealing with symptoms similar to what I described, or if you yourself are, you kind of know the pathway of treatment options for you. So hip osteoarthritis is definitely more common in the elderly population. About 25% of individuals who are above the age of 60 will have hip osteoarthritis. Things that make it more prevalent, or if you're overweight, or if you've suffered any kind of trauma to the hip previously. The presentation of hip osteoarthritis is similar to a lot of other presentations of the hip. Honestly, a lot of them are very similar. But you might experience pain in the front, like groin region. That'll be where your hip pain typically would be. That pain can refer to your bottom, down into your thigh, back of the thigh, which is, again, fairly common with other conditions as well. One thing that kind of sets hip osteoarthritis apart is that you might also have crepitus, which is kind of like a Rice Krispies type popping sensation in your hip with certain movements. And you also will probably be limited with hip mobility, typically kind of coming up towards you and then rotating side to side. Those motions can be limited as well. So maybe you have hip OA. Maybe someone else does. What do you do? Okay, so some treatment options for hip osteoarthritis are physical therapy. That's an option. So PT is fairly effective with mild and moderate cases of hip OA. About 70 to 80% of folks are going to see symptom relief. And then even greater than that, about 80 to 90% will see functional improvements, even though they might still have some pain remaining. If PT is not the route you want to go, or you've tried it and haven't had success with it, there's other options available. So some of those are pain medication, Tylenol, ibuprofen, so NSAIDs. Those can be effective in the short term. You obviously don't want to take those long term because they do have side effects. Another option, which the research has not proven to be as beneficial, but some people swear by it, is glucosamine chondroitin. So those are supplements that are thought to support good joint health, and those can be utilized. The downside of those is that they are going to take a while to work. So typically you'll have to take those about 6 months before you would notice any change at all. So for the short-term relief, the pain medications would be more beneficial than the glucosamine chondroitin. And then there's also some injection options. There's corticosteroid injections, which can provide up to 1 to 3 months relief. Again, kind of a short-term solution for most people. And then you can have those done again. You don't want any more than 3 or 4 of those a year, because those can actually have a negative effect on the joint and tendons if those are done too often, which I don't think any physicians are going to do those more often than that. But so there is kind of a downside to that, and typically about 3 months is how long you'll get relief with those. And then another injection option would be hyaluronic acid. I said it. I can't believe it. I said that. It's also known as viscosupplementation, and this is where they'll put something into the joint that will provide basically a smoother surface for a period of time. This can last up to 6 to 12 months. It can. Doesn't mean it's going to. This also is not paid for by most insurance companies. So where corticosteroid injections typically will be paid for by insurance companies. Some other options which aren't quite as found or proven in the research is PRP injections and stem cell injections. These are both thought to be beneficial, but the research has been done on small groups of people where they can't really prove the effectiveness of it like the other options that I just discussed. And then if those options don't work, and you've tried PT and it doesn't work, there's surgery. And hip replacement surgery is pretty successful. So if you get to this point, this stage in the game, you've tried those other options, it's definitely a viable option. Hip replacement is going to last you 15 to 20 years plus. And 85 to 90% of folks are going to find relief with this option if they've gotten to that point. Once you do have a hip replacement, you're gonna probably need some PT. So you'll typically have 6 to 12 weeks of physical therapy after you have a hip replacement completed. So I hope you found this video beneficial and you feel educated. If you need any assistance with anything, or if you'd like to try some PT, if you're at the beginning of this journey, visit our website at knobpt.com or give us a call. Thanks.